Welcome to Kathryn Raaker's World. Innovation, culture, adventure, fashion and health, artists, destinations, traditions. This is Kathryn Raaker's World.
Incredible advancements have been made in HIV care since the beginning of the epidemic, more than 40 years ago. Now, with nearly half of all the people living with HIV in the US over the age of 50, HIV research and treatment efforts have shifted to consider how to optimize care over the long term. Dr. Harmony Garges, Chief Medical Officer at ViiV Healthcare, is joining us now to discuss new data from one of the largest HIV medical meetings held earlier this month and key considerations in HIV care as people grow older. Welcome to our show, Doctor. How are you today?
Thank you so much for having me. I'm doing well.
Well, how actually has the HIV treatment landscape changed since the early days of the epidemic?
Well, HIV care has changed tremendously since the early days. If people want to recall back to the mid-1980s, we didn't have any therapy to treat HIV in the beginning. Then we did start developing medicines, but it required patients to take multiple medications multiple times a day, often to the point that they had to set alarm clocks to remind them when to take their medicines. And these medications had significant side effects. So thankfully, HIV therapy has evolved to the point that now most patients can control their HIV by taking one pill 1 time a day. And it's important to note that that one pill, that single tablet regimen, is a combination of either 2 or 3 medications all packaged together. And this has been really impactful for people living with HIV in terms of simplifying their treatment regimens.
What are some of the most important takeaways you'd like to share coming out of the International AIDS Conference? And where was it held? Do you mind telling me?
Oh, absolutely. It was a wonderful conference. It was in Montreal, Canada, and there was so much great science and research that was presented. For today, though, I will focus on 2 studies, both of medications that we make here at ViiV Healthcare. And one of them is a medication called Dovato. So Dovato is one of those single tablet regimens I was just referencing that has 2 different medications within it. And we did a study looking at older people living with HIV and asked them how satisfied were they with their treatment regimen. And what we found was that in this population, those patients taking the 2-drug regimen had higher treatment satisfactions than people taking standard HIV medications. So that was the first important study. The second one was one on a medicine called Rukobia. And Rukobia is used for people who've been living with HIV for a long time, who have multi-drug resistant virus. So this is a really important medication for this population. And we showed 5-year data from our clinical trial that showed even over 5 years, this medicine continued to work in terms of treating their HIV and continued to improve their immune cells. So 2 really important research studies about these medications. It's important to note, though, Kathryn, that these medicines, like all medications, do have side effects as well, and data on the side effects were also shown at the conference. So people should absolutely talk to their doctors if they have additional questions.
How could this research help address the evolving needs of the community as other things are happening to the HIV community that have just come up recently? How can that help?
So this research is really important because it helps to build physician and patient confidence in these medications. So that's a key component. For our 2-drug regimen, we need to continue to generate data and build that confidence around this medication. And we also need to do the same for people who are living with multi-drug resistant HIV and make sure that over the long term, these medications continue to work in that patient population. So this is really important for us at ViiV Healthcare. Our mission is to make sure no one living with HIV is left behind, and these 2 research studies really demonstrate how we're living that mission.
Now that many people are living with HIV and are growing much older, what are the key treatment considerations to keep in mind? And what if someone comes down with HIV after all these years? How do they treat them? The same?
Yeah, really good question. So again, with the advances we've had in HIV care, the wonderful thing is people now are living longer lives, and many living normal, productive, healthy lives. 50% of people living with HIV right now are over the age of 50. And that population is quite diverse and has different needs. For people who've been living with HIV for a long time, we have to make sure that HIV treatment is part of their overall health plan. So looking at what other medical conditions they have, what other medications they're taking, and making sure that their HIV medications are optimized for them. The point that you just raised is, what if someone's newly diagnosed with HIV and is aging? And in those people, they're treated just like anyone else who would be diagnosed at a younger age.
Right. And the other thing is, let me ask you this question. Are you seeing during the pandemic that a lot of HIV patients were not being seen or actually weren't taking their medicine or couldn't get their medicine?
Yeah, the COVID pandemic definitely affected people living with HIV. What we did see is that people weren't getting diagnosed as frequently as pre-pandemic because it was more difficult to get in to get medical care. Thankfully, most people who were already diagnosed and living with HIV were able to maintain connectivity with their physicians through telemedicine and telehealth, but we definitely saw an impact on HIV testing and new diagnoses.
And where can everyone learn more about your study and the medications and what to do if a relative or friend comes down with HIV and needs help and support?
Absolutely. Well, the most important thing, of course, is to reach out to their healthcare professional, their physician, and have these conversations. In today's world, we have wonderful medicines to treat and prevent HIV. So I would encourage anyone who has additional questions around that to speak to their physician. And then, of course, they can also go to our website to learn more about the 2 medicines that I talked about today, Dovato.com or Rukobia.com, if they would like more information.
And I want to thank you for your mission and what you're doing and how the world for HIV is coming. And eventually, maybe people won't have HIV. That's what your goal is, isn't it? And the mission?
That is 100% our goal. We are absolutely working toward cure, but until we achieve that day, we are here until HIV is not.
Thank you so very much for joining me today on Kathryn Raaker's World and Let's Just Talk. Thank you.
Thank you.
Hi, this is Kathryn Raaker of Kathryn Raaker's World and Let's Just Talk. Our guest today is very distinguished, Dr. Craig von Busick. He's published author and digital content manager for the parenting section of FocusOnTheFamily.com. He's a contributing writer for CBN.com, MTL Magazine, The Right Conversation.blogspot.com, and Charisma Magazine. He holds a Doctor of Ministry and an MA in Religious Journalism from Regent University. His most recent book is Victor, The Final Battle of Ulysses S. Grant. Craig's book, I Am Cyrus, Harry S. Truman and the Rebirth of Israel, won the prestigious Zila Award for Nonfiction and was nominated for the Truman Award by Harry S. Truman Presidential Library. Craig is also the author of Praying the News, co-written with the 700 Club co-host Wendy Griffin. Nobody Knows the Harry T. Early Story, Forward, The Leadership Principles of Ulysses S. Grant, Netcasters, Using the Internet to Make Fishers of Men, 7 Keys to Hearing God's Voice, and other ghost-written books. Craig has an extensive speaking experience and travels often to speak at conferences, professional and ministry events, and writer training seminars. Craig served for several years as a ministries director and program director for CBN.com, one of the world's most popular Christian websites. I want to welcome you to our show today.
Well, thank you, Kathryn.
It's such a pleasure. I'm really excited about all of your books. And how long have you been writing, Craig?
Well, pretty much my whole life, but in my 30s, I decided to make it official.
Official?
And
Okay.
so I attended Regent University in Virginia Beach, and as you said, I did a joint degree studying journalism and divinity because I wanted my writing to also be part of my ministry.
Right. Let me ask you this question. This is the newest book we're talking about, but this is a brand new book coming out.
Right, exactly right.
And this is different than this one. This is a historical novel,
Mm-hmm.
and this is a Walking in Faith, the Peter, Paul, and Mary Principle. And I love this. This is so beautiful. We'll show you the beautiful covers of each book. Craig, you're going to send that to me.
Mm-hmm.
And would you rather me call you Dr. Craig?
No, Craig is
Okay,
fine.
Craig
Yeah.
is fine. How long does it typically take you to write a book? Say, for instance, Victor, the Final Battle of the Ulysses S. Grant.
That book actually took 2.5 years between the research, the writing, the editing. I actually went to almost all of Grant's homes that he lived in.
Wow.
I went to all of the major Civil War battlefields and interviewed several experts and went to the Presidential Library at the University of Mississippi.
Wow.
And so it requires a lot of research to do a biography like this one.
Especially historical.
Yeah, so
Right.
this actually has 1,100 endnotes to support the information that's in the book.
Is there anything that really surprised you about Ulysses S. Grant?
There's so many things that surprised me,
Kind
but
of give us an idea of
Yeah.
what it was like.
well, there are a lot of false narratives about who Grant was. And so as I dug into these things one by one, I was able to unravel what was, twisted history or what was political spin. You need to remember the Civil War was it was the most difficult time in our nation's history. And because Grant's strategy actually, along with Lincoln's support, helped to win the war, the former Confederates hated him. And so there was all kinds of, among the academics, among the historians, there was all kinds of false narratives. I mean, not like we don't see that today, right?
See it a lot
yeah,
today.
exactly. And there's
That's
nothing new under the sun.
No.
And so they said that Grant was not that smart. They said he was an alcoholic. They said that he was a butcher. And I found that all three things were false, that he was actually a genius, a strategic genius. He was an alcoholic, but he wasn't a drunkard. There's a difference between those two things. And he overcame his alcoholism pretty much before the Civil War ever began.
Right.
And then the aspect of him being a butcher, there was a man named Bonekemper who did an analysis and found out that the deaths under Grant were lower than the deaths under Lee. So you can't say that Grant's a butcher and not say Lee's a butcher. It's a war. There's going to be people who are killed in the war. So it was really fascinating to uncover these things.
You know what amazes me during the last, I'd say 4 or 5 years, we tried to destroy history. And I don't know why. People have a strange idea about getting rid of statues or getting rid of whatever, and this is part of our history. I mean, I was very fortunate that I got to go to Gettysburg, that I got to go to a lot of the wonderful places that are in history that we should know about.
Yeah.
And I think that it's going to come out in history that our former President Trump was brilliant in the way he handled our country and what he wanted to do, even though there's so much hatred, which I haven't figured out yet, for him and his family. And it's sad. So, we're in troubled times right now.
Yes.
And it probably reminds you of what was happening back then. Am I right?
Absolutely. And, It is, every generation has the same type of things. Some generation it gets more heated, like in the Civil War, like during World War II, and Vietnam, and what we're going through right now. And then there are times where we get little bit of a lull. But even in the lull, there's always the political spin that goes on. And it's just something, that's really one of the reasons why I feel called to write about history, and why, like my other book is called I Am Cyrus, Harry S. Truman and the Rebirth of Israel. You want to talk about something that gets political spin. The nation of Israel has all kinds of propaganda and basically anti-Semitic type of spin that goes on there. And so in that book, I actually have over 1,200 endnotes, because I said, I need to make sure that this is based on truth to the best of my ability.
I have to tell you, I went to Israel. I was very fortunate. The Israeli government actually invited me to Israel.
Wonderful.
And everything was paid for. It was through the government program that I got to see everything that I got to see.
Mm-hmm.
And I felt safer in Israel than I do in our country.
Mm-hmm.
And they were so good to me. Part of my family is Jewish.
Oh.
And I found out that, and that's one of the things that my grandmother asked me to go there. No, my mother asked me to go there and find out the history of our family.
Wonderful.
And I'm so glad I did. There's one thing about that Harry S. Truman. Did you know that he never got a pension?
Mm-hmm.
Was that a shock?
No, it was not, because Grant didn't have one either, and that was part of the truth of this book. So in both books, that was an issue.
That was an issue.
Yeah.
You know, one of the things that I found out about Harry Truman was that he was the last president not to receive a pension.
Mm.
Did you know that he went to work in a shoe store?
Mm-hmm.
And that he had no protection when he left office and went on the trip, and they paid for it themselves.
Wow. Yeah. It's
I
amazing.
mean, I really thought a lot of Harry S. Truman.
Yeah.
I really did.
Yeah, me too. He was
pretty awesome.
one of our great presidents.
He really was. He had
Yeah.
to put up with a lot, right? What was the biggest surprise that you had about Grant?
Well, I think the biggest surprise was that he was one of the greatest strategists we've ever had as a general, to the point where still to this day, military colleges around the world study his strategy, and specifically the Vicksburg strategy. People said at that time, there's no way that Vicksburg will fall. And Grant tried several different approaches, but he finally came up with a strategy that would win. And in that, he sent out 3 different diversions to trick the General Pemberton in Vicksburg to thinking that, oh, they're coming this way, oh, they're coming that way, oh, they're coming, and Grant wasn't coming any of those ways. And the whole time he was marching his troops downriver without the Confederates seeing it. And so he was really one of our great generals in American history.
Right. When was this picture taken, do you think?
Well, that actually is a painting.
A painting?
Yeah. And it was really cool because the publisher, Iron Stream Media, worked with me, and they asked me to go out and see, because I said, you know, so many of the pictures from the Civil War or of Grant's other books are black and white. I want this to be in color. And I came across this wonderful painting that had just come into public domain. So as far as I know, this is the first and only book that carries that wonderful painting.
And it's gorgeous. He must have been, what, in his 50s or 60s, or how old was he when you think that was taken?
That was probably in his 50s.
In his 50s,
Mm-hmm.
right. So the other 2 books, Forward the Leadership Principles of Ulysses S. Grant, is a different book, correct?
It is. That is a companion book that teaches the principles that Grant used for success in his life.
That's wonderful. So, Walking in Faith, the Peter, Paul, and Mary Principle. Tell us all about this one.
Well, this is something, as I was doing just some Bible study, I saw it first in when Jesus calls Peter to walk out on the water with him. Mm-hmm. And it's a principle of faith, and I was kind of shocked by it. I thought, oh, isn't that interesting? And then I saw the same thing in Saul on the road to Damascus, who, of course, became Paul. And then I saw it with Mary when Gabriel appeared and told her she would carry the Christ child. And I said, well, that's very fascinating, Lord, but what does it mean to me? And he said, I felt like the Lord said, overlay it on your salvation experience. And I did so, and it fit like a glove.
Oh, that's wonderful.
And I went, wow. And I felt like he said, this is a principle through which you receive everything that you receive from God. So it's important for people to understand that faith is an important doctrine. Jesus twice marveled, the Bible says. First time was at the unbelief in his hometown. The other time was at the belief of the centurion. And basically it is the currency of heaven. And so it's important for us to realize what is a proper, balanced, biblical view of faith, because there are some times where people get out of balance on that. But at the same time, to understand that God has given this to us as a gift, the gift of faith, and we need to understand it in order to walk in that abundant life that God wants for us.
You love doing what you do today.
I do.
And focus on faith. How often do you do that? Every day?
Yes. I would say that is a part of our day-to-day lives as New Testament Christians. And so it is important for us to understand what God has given to us as a promise, but also what he hasn't.
Right. And sometimes we don't listen.
Yeah, that's right.
And when I went to Israel, I felt like it was just a closeness with God. And, going through on the government program was so different because there were only 3 of us that went in our guide.
Oh, wow.
And I even got to go on the border of Jordan where the soldiers were. I got to talk to the soldiers. I got to do things that nobody probably would get to do.
Wow.
And, being a conservative media person God is with me all the time, I have to tell you. Because I think there are so many people that are so frightened, I don't know why. God's with us every single day. Am I right?
Yes, absolutely. And I was also blessed to go to Israel
When did
with
you
the
go?
same thing, 2003, at the height of the Intifada.
Yeah.
And so the bus bombings were still happening because the security fence had not been completed. And so they brought journalists like you and I to Israel to write stories to encourage people to travel there because tourism is a big part of their economy.
Exactly.
And so I was really honored to be there.
Well, the Bible Comes to Life is a program where I used to work with Bible Comes to Life and brought some people to them from the United States that actually bring tours over to Israel. I couldn't take that full job because I had this.
Right.
And God told me, this is what I want you to do. So a friend of mine took it over, and she still does it today.
Oh, wonderful.
And it's really a great program. And I sent my church to it with my pastor, and he really loved it. And, it was just different than the one I went on. But
Yeah.
I would go back to Israel in 2 minutes.
Oh, me too. You let me know. Maybe we can go
maybe we should
together.
go together
Yeah,
and
let's
do
do.
it
We'll do
together.
some shows from over
we'll
there.
do some shows all over there. Well, that's kind of what I'd love to do.
Yeah,
again,
me
because
too.
I really absolutely loved Israel. The most poignant thing that I remember was going to the children's Holocaust Museum with all the lights. Did you go? You went
I
there.
did, yeah.
And to go to Masada. And just the different things that we did. It was so unreal. And to go to the restaurant where the 5 fishes, which are tilapia, you know that word.
I didn't know that.
right on the water of where they have the boats. They own all the boats that takes you out onto the
The Sea of Galilee.
Sea of Galilee. And to throw a net out.
Wow, how
And
fun.
So, but I got to meet the people that own it all.
Oh, nice.
And that was an experience in itself. But to
Yeah.
find out that the fish were tilapia.
Yeah, I didn't know that.
That's
That's
something
fascinating.
really. So I want to thank you. Can you tell me where people can buy all your books?
Yeah, everything is available on Amazon, or they could go to my website, which is just my last name, VonBuseck, vonbuseck.com. Either way, they can get the books.
I want to thank you so much for joining
Thank you,
me today
Kathryn.
on
It's an
Kathryn
honor to be
Raaker's
with you.
World, and Let's Just Talk. I'd love to have you back on. and I'll give you a call in a couple of weeks.
Yeah.
And I'm going to send you my book, my first book.
Please do.
And our second book is coming out. I'm so excited at Christmas time.
Oh, good. Well, that's wonderful.
And my son tells me we're going to do 7 more books,
Okay.
which is a series.
Very good.
So I'm very excited. So I can't wait to read this. I mean, I can't wait to read all of them.
Thank you.
Thank you so much.
Well, it's my pleasure. Thank you for having me.
And don't forget to go to our website at Kathryn Raaker's World. That's Kathryn Raakers, world.com. And let's just talk. And don't forget to go to the Chef You and I. We'll see you very soon.